Hello, everyone. Welcome to the second Tobacco Free Team podcast. I'm Sneha Thomas, the Health Improvement Lead for Tackling Tobacco Dependency. With me, I've got Shima Rahman, who is the Head of Health Inequalities, and Mark Palmer, who is our Tobacco Dependency Treatment Advisor. So, today's podcast, we will be talking on the acute pathway and stop smoking AIDS. We will be discussing how the Gloucestershire NHS Foundation Trust went live and how they are right now. Also, we will be discussing on the various stop smoking aids, which is basically the nicotine replacement therapy, and how it helps the smokers to give up on smoking. Without any more delay, my first question is to you, Shima. So, can you please tell us when did Gloucestershire NHS Foundation Trust actually went live with the tobacco dependency treatment program?
So we went live in November 2022, and we have the health improvement lead and a tackling tobacco dependency advisor came into post at that time. We needed a systematic way of recording all the smokers that come into the hospital. So prior to the team starting, there was no real way of identifying who all the smokers were, and we went into a process of trying to identify who our smokers were in the hospitals so that the treatment advisors can come and talk to them. It started rolling out in the respiratory unit, and that's where we kind of did our pilot program and trying to kind of work out any challenges that we might have across any other areas in the hospital. We used the respiratory team to kind of test out our systems, and using that QI approach is how we then moved forward into other wards in the hospital.
All right, that's good to know, Shima. Can I know what is the current treatment pathway like?
So as soon as somebody gets admitted into hospitals, our nursing colleagues or the person clerking the patient into hospital will do a very brief intervention with them. They will get identified, ask their smoking status when they come into hospital, and they will be told that there is a tobacco treatment team, and they'll be offered that support when they come into hospital on an opt-out referral basis. They'll be offered nicotine replacement therapy, and they will be then put on our dashboard, and the team will be able to go and see them within 24 to 48 hours. And we will then subsequently send one of our treatment advisors to speak to the patient about their smoking habits. And we do treat it as an addiction now, hence why the urgency of speaking to people when they come into hospital. We will then follow up at 10 days, and then after discharge, and 28 days after discharge too. The patients are given the option to also get support from a community healthy lifestyle service. So that will be their onward referral package, and they go home with 2 weeks supply of NRT.
Right. That sounds really great. It sounds like a lot of work were put into it, and you've come a really long way. I wanted to know, is there some of data system in place? Like, how do you monitor your progress?
So we use the QI approach on this. It's that systematically asking the question, ensuring that every patient who comes into our hospital gets asked that question of, are you a smoker? We identify their smoking status. That gets recorded into a specially designed dashboard that we have, and that was created by our BI team, and that monitors, and it is updated every half hour so that we can see any patients that are admitted throughout the day. And the record, it's put on the electronic patient record for the patients, that then gets transferred onto our dashboard. And it then gets updated to us. That dashboard is also used to send the NHS England submission requirements. So it captures all the information required on the other side to submit the data to NHS England too. It informs the activities of the team so that my team can come in and see where our patients are, exactly which wards they're in, which clinician is leading on their treatment as well, and also whether they have been previously admitted into hospital, so that we can identify those kind of repeat patients that are coming in and ensure our conversations are targeted in such ways to help support them.
Yeah, that dashboard sounds pretty useful. Can I ask, what do you think has improved after the commencement of the service?
Um, so when we first started in post, and Mark, when he comes in, he'll also tell you, we only had about 35% of our patients being identified as smokers. At the moment, our compliance has gone up to about 84 to 85% as a trust, and saying that some wards are achieving 100% compliance on recording smoking status. So every patient is spoken to about their smoking status and whether they are a smoker or not, and also informed that there is a tobacco-free team in place that can come and support them to stop smoking while they're in hospital.
Yeah, I mean, it's pretty huge going from 34 to 84, isn't it?
Yeah, pretty
That's a
much.
very good record, I must say. So, Mark, since you are one of the tobacco dependency advisors in our trust,
Hmm.
and you are the one who uses the dashboard more
Yeah,
often, can I please ask, how do you find it? Do you find it really useful?
yeah. At this stage, I find it very useful. Obviously, we've had to tweak things, and we've really developed it over time. But at the point it is now, it gives a great overview of all the current smokers in hospital. It also shows who's former smoker, never smoked, etc., etc. We can see where the patient is, we can see all their details, and then we can look them up on EPR. We can look at some of their medical history and get the information that we need before we go and see them. Um, it's also a great way of recording what we're doing. So, for example, we do follow-up calls with the patients as well at 10 days and 28 days. So um, we can put a note on EPR to say that, for example, that 10-day follow-up has been done. That will then show us that it's been ticked off on the dashboard. So it's a good way of sort of organizing what we're doing and keeping track of what we're doing. Um, like Shima said, it updates every 30 minutes. So when patients come in, if we get a new referral, we can go and see them, pretty quickly, and we can also see if they've moved, which quite often they do. They move around the hospital. We can see, where they've moved to. Um, yeah, so it's I say pretty useful. We can also see, this is an option which we added later on. We can see if they've been readmitted within 30 days. So, we know from the research that smokers get readmitted, more often. So this is just really we can just sort of highlight now that, we're seeing a lot of these patients that we are seeing more regularly.
Yeah,
Okay.
that's good to know. Thank you, Mark. And also, I'm sure being an advisor yourself, you must have done lots of training. And I believe you've done the NCSCT modules, which is the National Center for Smoking Cessation Training. And basically, they do follow the NICE guidelines. And that's like the bread and butter for any advisor, I would say. Do you think there is any sort of training available for the staff, especially for the ward staff, so they can help the smokers out there?
Um, I believe there's e-learning, VBA training e-learning.
Right. So
Yeah.
what does the training comprise of?
So it's VBA training, so it's very brief advice. So first is just to sort of give people an overview of what it's like to be a smoker. So about the withdrawal phase, which happens very quickly. So that's why it's important to give them the NRT. But it's that very brief advice. Obviously, when people come into hospital, the more they get asked about their smoking, I always like to think it has a compounding effect. So it's trying to make that link between their admission and with them being a smoker. So it becomes more powerful the more people that ask that question and offer them that advice, which is you're more likely to quit smoking with behavioral support and NRT, which we've got at the hospital. So
Yeah, that sounds
yeah.
good. Also, are there any sort of support materials available? I mean, do you have any sort of leaflets or things like that?
Yeah, we've developed some patient handouts with various bits of information on things like how to cope with cravings and triggers. There's also information about where apps and things like that which can help them, and to show them how quitting smoking can help manage some of their conditions, that their health conditions and things like that. Yeah, so we've got leaflets and things that we've handed out. Yeah.
Yeah,
And
that's good.
sorry,
Sorry.
Sneha, I think another key component of the very brief advice that we offer is we offer that on the ward to all our colleagues on the wards. 30 minutes, and it's part of just our cultural journey of ensuring that we're treating tobacco as an addiction. So our tobacco treatment advisors are place themselves on the wards next to the ward staff to be able to talk about smoking. And the I think Mark has spent a lot of time delivering that on the wards, and each day you get new staff coming in, and it's really an important part of what we're doing and how our team has progressed is by teaching and educating our colleagues around us about what smoking is and the impacts of smoking and the importance of why we need to support patients while they're in hospital. So that's kind of a rolling program in our hospital where all staff will get that VBA advice training on the wards so that it is supporting them to be able to have those conversations on admission as well.
Yeah, I think it's pretty good as well, Shima. Thanks for chipping in.
Yeah.
So Mark, back to you. So we've been talking about nicotine replacement therapies a lot. Can you
Hmm.
please explain what is actually a nicotine replacement therapy and how it helps smokers to give up on smoking?
So nicotine replacement therapy is essentially replacing the nicotine that they would normally get from smoking a cigarette, and putting it into a product which is safe
Mm-hmm.
to use. And it essentially what it does is help to manage the cravings. So I always like to think there's two things going on when someone quits smoking. There's the psychological aspect of actually lighting a cigarette, and all that sort of thing, rolling it, whatever it is. And then there's the nicotine dependence on that chemical. So if we can just deal with that nicotine dependence, just especially in the early stages of quitting smoking, which is when someone's more likely to relapse, if we can at least take care of that, then the other side of it, the cravings, the triggers, those situations which are going to be harder for people, which are going to make people more likely to relapse to smoke, things like that, they can learn to we can help them with that as well. um but but we've got to treat the medical side of it as well. So there's really two types of NRT. There's slow acting and fast acting. So patches are slow acting. They absorb through the skin, and you've got two types. You've got 16-hour patches and 24-hour patches. There's pros and cons of both. The 24-hour patches are good because they will deliver the nicotine throughout the night, and when people wake up in the morning, their nicotine levels are very low. So that's when they really enjoy smoking, is first thing in the morning. and it helps people to wake up and things like that. It's more of a process. So having that nicotine throughout the night, when someone wakes up, they're not going to feel tired and groggy and wanting to have a cigarette to start the day. They're going to be feeling like they're ready for the day, hopefully. It can cause some sleep disturbances. So obviously that's why people will opt for the 16-hour patch in that case. Some people don't really smoke that much in the morning as well. So 16-hour patch might be fine for them. They're not smoking. It's not something they would do first thing in the morning anyway. So so you've got that. So that's the sort of more slow acting. And then you've got the faster acting NRT. So we know that when people smoke cigarettes, that is a really rapid delivery of nicotine. I believe it's 6 seconds, maybe even less than that. So that's why it's so addictive. It's that rapid delivery of nicotine to the brain. So we're trying to get as close to that as possible with the other products. So you've got things like gums, mouth sprays, inhalators and things like that, which are taken, you can absorb them more quickly into the body, and they're really for when you get more intense cravings, wherever they might be. So yeah, it's down to personal preference really. So there's lots of different options with that.
Yeah. Well, thanks, Mark. I think that explanation was just perfect. And I believe this is the sort of information you give to service users who basically ask you which patch is the better, whether it's the 24-hour patch
Yeah.
that they should opt for or for the 16. Shima, back to you now. So we've talked about the various sorts of nicotine replacement therapy we've got to help smokers to quit smoking. Just wanted to ask, have we got any other stop smoking aid other than NRT?
There are other stop smoking aids, and vaping is an obvious choice. However, it's not something that we offer to our patients while they are in hospital. Nicotine replacement therapy is our first line of choice, actually, to support patients, supported by that psychological intervention that they're getting from our tobacco treatment advisors. We do have a podcast that is going to be aired very soon as well, with our clinical lead, Dr. Charlie Sharp, who will talk about his views on vaping. And we have produced some communications around vaping, and that will hopefully be distributed in the coming weeks, and coinciding with No Smoking Day coming up next week as well. I think the key things are to ensure that the vaping products that we get are from reputed suppliers and that meet the UK standards. And from a hospital point of view, it's not something that we're doing right now, but we do understand there are a lot of people vaping and there are a lot of questions around vaping. So it's more watch this space for us right now. There is a new drug that is currently available called cytidine, and we will slowly start utilizing that drug. So we've just placed that on our trust formulary right now, but we haven't as yet started prescribing it.
Wow, that's brilliant. Um, Mark, back to you. So when you have conversations with your service users, when you basically help them to quit smoking, uh, do they ask you about the side effects of NRT? Do they get worried about it?
Yeah, that's a good question. They do. I think the most common misconception is, they're replacing one thing for another. So it's because it's got nicotine. So often it gets confused with what's really doing the harm. Is it the nicotine, or really what we're talking about with the harms of smoking is the carbon monoxide and the tar, etc. The thousands of chemicals which are in tobacco smoke. So really, with the nicotine, it's a clean form of nicotine, at a much, it's at a lower, possibly at a lower dose that they would normally be using as well. So, and again, I think they're worried that they might become addicted to nicotine replacement therapy, but I think it's probably not impossible because nicotine, at the end of the day, nicotine is an addictive substance, but it's that method of delivery that you get from smoking a cigarette, which is rapid compared to a patch. It's probably very unlikely that I don't, that there's a very low possibility of addiction through taking nicotine replacement therapy. So yeah, that's the main thing. Yeah.
Right. Okay. Thank you. And just wanted to add on to that. Is there any sort of I mean, does NRT affect any sort of medication that the service users take?
I mean, it can do. It's quite unlikely. I mean, when someone is quitting smoking, that can have an effect on certain other medications as well. So it can make, if someone's not smoking, it can make that medication essentially work better. So they might need their dose adjusting for that medication, just the way that the body's metabolizing. When people smoke, it's going to metabolize that medication, quicker. If you see what I mean. So that's the only thing. But with the NRT, there are cautions associated with NRT. But yeah, apart from that, it's pretty seems to be pretty safe to use.
Yeah, and I think it's just letting our service users know it's actually the tar in the cigarette that causes the reactions with the medications and not the nicotine. So with that, have you got any service users that both smoke and use NRT at the same time?
Yeah, some do.
Yeah.
So
What is
it's
your advice on that? Do you encourage it or do you ask them to completely give up on smoking before they take up on their NRT?
I I think it's a bit counterintuitive, really. I wouldn't recommend it, but I suppose there is a kind of school of thought that you can use NRT to cut down on the amount that you smoke. Um, so you could look at it from a harm reduction point of view. Um, so yeah, but I think it's probably better just to try and get out of the habit of smoking and use the NRT completely. From my point of view, but and I suppose there is the danger of, if someone's taking a patch, for example, they're getting 21 milligrams of nicotine, and then
Mhm.
they're still smoking on top of that, as well. So they're probably not in control of how much their nicotine that they are taking. So it might make them feel a bit nauseous or not particularly very well if they're smoking on top of taking extra nicotine into their body. They've got that constant nicotine going into their system through a patch, and then they're also topping it up with, cigarettes. So that's probably not gonna, yeah,
Yeah, so you're saying the ideal choice would be to completely give up on smoking and then take up NRT.
yeah.
Right.
And if that doesn't work, then it's probably a case of that they're just not taking enough NRT. I think people don't realize how much NRT they need to take. So yeah, it should, yeah.
Yeah, and I think that's where the advices come into play. They explain about how the level of nicotine dependency affect their whole body, and then they prescribe the right patches or the gums or whatever sort of NRTs they are preferring. Right. My next question would be, do you know smokers when they try to give up on smoking, they start with the patches or with any other form of fast-acting NRTs, and they expect to see very quick results. So, do you think that using an NRT is going to completely take away their cravings?
No, I don't think it's going to completely take away their cravings. I think obviously they need to have the motivation needs to be there, and you know, the desire to quit smoking alongside the knowledge of how to do it with the right help. But I think it's going to reduce the cravings, but it doesn't completely take it away. It's not you know, it's not sort of put a patch on and, you know,
Yeah.
I'm cured sort of thing. It's an ongoing process. So yeah, but yeah.
Yeah, just wondering on such instances, do you stress on the importance of combination therapy?
So combination therapy, you know, even if a patch is probably not going to be enough for some people as well. That's not going to give them enough nicotine, especially for heavy smokers. So, you know, given they're going to have a, you know, combination NRTs, you know, going to be much better to top up their levels when they need it. Yeah.
Right. Okay. Thank you, Mark. So, Shima, I'm going to come back to you. I know our session is on acute pathway, but just a quick question. Do you think it is safe for pregnant women to use NRT?
Oh, absolutely. And I think there's enough evidence out there to suggest that it is safe for pregnant women. And we do have a separate pathway to support pregnant women on their quit journey as well. And we have a maternity team and a team of maternity support workers who will support pregnant women in Gloucestershire to stop smoking during the duration of their pregnancy as well.
All right. Thank you very much. I know we talked a lot about inpatients. We basically told like how we support them, the sort of NRTs we give to them. Is there any sort of support that we give for our outpatients?
There are support available for outpatients, mainly using the community healthy lifestyle service. Um, from a hospital point of view, it is something that we will be picking up in the next year to support our outpatient colleagues to be able to deliver that very brief advice to patients to get them to think about their smoking. And it's something that we're likely to pick up this year to support them, really.
Right, that's good. With that, I'm gonna come to the last question of our podcast. And I think if there is any of the staff members listening to this is probably one of the questions that they are looking forward. Do we have any sort of offer for our staff to help them quit smoking?
Um, we have had staff offers in place where we've had our members of our team supporting staff to stop smoking as well. Um, the model changes, and I think it needs to be developed alongside staff to understand what will help them to stop smoking. Again, it is something that we're working on this year, but we will work with our staff to understand what their needs are and how we can support them moving forward. But our support is predominantly provided to the inpatient pathway, and we do encourage staff to reach out to us because we will also support them, and we've had pathways where they can do that, and they can contact us through our team phone numbers, through our email addresses, through the intranet, and just by talking to any of the advisors when they're out on the wards as well. So we do encourage staff to come and talk to us even if there isn't a specific pathway in place for them.
All right, thank you, Shima. Like I said, that was my last question to the team, and I think we've covered pretty much everything, unless you guys want to add something on.
I think that's it. Thank you very much for having us, Sneha.
All right, I should
Yeah.
say thank you to you both. Thank you for your valuable time, and I think that session was really interesting. It would be helpful for our service users as well as for the staff members. Um, with that, I'm probably going to conclude our Tobacco Free Team podcast today. Thanks for your time again, and see you soon.
Thank you.
Thank you.